So a lot of times we get questions about insurance in our office because, just in our society, we're used to when we go to a healthcare practitioner, like that's just a normal thing that people ask. Like, do you accept my insurance and do you take so-and-so insurance? So totally understandable. But from the time that we opened up, our office has operated outside of normal insurance procedures and things like that. And this is the reason why. It's not that we want to make it more difficult for people. In fact, we try to make it more convenient for them most times and more affordable. But we realized from the get-go that if we were going to give people the best care that we suggested, that we knew was best for their families, we had to be able to do that freely. Sometimes the insurance company is going to try to dictate how much care you can receive. Well, understand as a healthcare provider who is here for the best interest and care and health of the person standing in front of me, that I have to unbiasedly say, this is what I found with you, and this is what's going to be best for you as your healthcare provider. I want to be able to make that decision without anything else hindering that or influencing that. But also because of this, we want to work with every single patient that comes in. Sure, we have a fee and we have a cost, and things do have a cost, and they're worth that. But I want to be able to work with every single patient that comes into my office and say, here's the care plan we suggested. And this might be a lot of care, or it might be a lot of visits to come in and show the cost, but we're going to work with you. And here are some different options, right? So our girls will go over, let's say, 3 different options that they have where they can come, that we work to make it more doable, more affordable, and work with them however their finances line up, including their full family. When we operate inside of insurances, sometimes that's much harder to do, right? And we're worried about, is the insurance going to pay it? And is the insurance going to cover it? And we still have people that we have to walk with through that say, well, my insurance isn't going to cover it, so I can't get the care that I need, which is the absolute most upsetting thing that there is. Somebody needs care and doesn't get it because a third party won't pay for it. So therefore our health is detrimentally affected because of a third party arbitrary. It just doesn't make sense. And so it's a broken system. And so we operate outside of that, so that is not a factor. And we do our best to work with the people and the patients and the families to get the best care despite that and still make it affordable.